Hi friends, welcome to our YouTube channel Pharma Basic. Today we are going to discuss about the blood group. So whenever you saw the so many type of blood group, it is there: A positive, A negative, O positive, O negative. So what it means and how these blood groups are differentiated. So in this video we are going to discuss about this all. So first we are going to discuss about the what is blood grouping. So blood grouping is nothing but it is the classifying the blood on the basis of presence or absence of certain antigen on the surface of RBC. So here is mainly two system is there. One is ABO system, another one is RS factor. According to the ABO system, blood are classified into mainly four, that is A, B, AB and O. And according to RS factor means this is rhesus factor. It is a protein which is present in the surface of the RBC. According to this RS factor, blood group was classified into plus or minus. So why it is important? So blood grouping is very important in medical science, which is helping the blood transfusion, organ transplantation, forensic science, pregnancy. Like in blood transfusion, for organ transplantation also blood grouping is very important. Then after the in pregnancy, so checking the mother baby's health, blood grouping is important. In forensic science also blood grouping is important. So beyond this, in emergency cases also blood grouping is important. If you know your blood group in emergency cases, firstly we can give the blood or arrange the blood for transfusion. Or in surgery cases also it will help in blood grouping. Now we are going to discuss about the types of blood group. So according to the ABO system is differentiate the blood on the basis of presence and absence of antigen A and antigen B on the surface of red blood cell. And RS factor it is the present or absent of RS factor on the surface of RBC. So here is the chart. In this chart, here is antigen A, antigen B, antigen both A and B antigen. Then after no antigen is there, then after RS factor present and absent. So according to this, if we combine this ABO system and RS factor, total 8 blood group is there. So how it is differentiated? If antigen A is present and RS factor is present, then it is A positive, and antigen A is present and RS factor is negative, then it will be A negative. If antigen B is present and RS factor is present, then it will be the B positive, and antigen B is present and RS factor is negative, then it will be the B negative. If both antigen A and B is present and RS factor is present, then it will be the A positive, and both antigen A and B is present but RS factor is absent, then it will be AB negative. If there is no antigen but RS factor is present, then it will be the O positive. If no antigen is present or no RS factor is present, then it will be the O negative. So in this way, blood groups are mainly divided into 8 types: A plus, A minus, B plus, B minus, AB plus, AB minus, O plus, O minus. So in this, antigen A produces the anti-B antibody in the body, and antigen B which produces the anti-A antibody. So where antigen A, B both are present, there is no antibody is there, and if there is no antibody, if there is no antigen, both antibody A and anti-A and anti-B antibody will be produced. So now we are going to discuss about how we find out this blood group. To find out the blood groups, we have to take a small small amount of blood, 3 drops of blood, and 3 chemical named NTA, NTB, NTD. These are the antisera which is used for determining the blood group. So in a slide, take a 3 drops of blood. So in the 3 drops of blood, we have to add this 3 chemical which is antisera. This is NTA. In first one NTA, second one NTB, and third one NTD, which is used for NTD is used for RS vector. So then after mixed with a stick properly, after mixing, check these drops properly. If after mixing agglutination is present, so in that one is positive. If clear no agglutination or coagulation is happened, it is absent. So here we can see in NTA, that means in first drop it is agglutinate or coagulate, and in NTD it is coagulate. That means NTA means that is A, antigen A is present. So in NTD it is positive, that means RS factor is positive. So that means its blood group is A positive. So you can see here, so that is become A positive. Here it is agglutination in B, and this one is NTD is present, these two, then it will be the B positive. If both are positive with this one also, it will become AB positive. If there is these two are not positive and only this one positive, then it will become O positive. So in this way we have to find out the blood group. So here is the standard chart from where we can understand about the blood grouping. So if NTA coagulate and NTD coagulate, that means RS factor is present, antigen A is present, then it will become A positive. And B1, second one, it is with the, here is NTA is coagulate but RS NTD is clear. So then there is, that is become A negative. In second one it is C. In NTB it is coagulate and NTD it is coagulate. And it means RS factor is present and antigen B is present, then it is become B positive. And here NTB is coagulate but RS factor is negative, so it is become B negative. So here you can see all 3 dots, that means NTA, NTB and NTD all are coagulated, so that means it is AB positive. Here see, antigen A is present, antigen B is present, but NTD is absent, so here AB negative. Here you can see antigen A is absent, antigen B is absent, only NTD is present, that means only RS factor is there, that means it will become O positive. Here see, there is all 3 dots are clear, that means NTA absent, NTB antigen A absent, antigen B absent, antigen D absent, that means it is O negative. Now we are going to discuss about the antigen and antibody of the blood. Antigens are present in the surface of the red blood cells and they are going to trigger the immune system to produce the antibody. So after triggering antigen A, trigger the immune system to produce the NTB antibody, and antigen B going to trigger the immune system to produce a NTA antibody, opposite one, antigen A, NTB antibody, antigen B, NTA antibody. So antigen, if antigen A and B both are there, then there is no antibody will be produced. If no antigen is there, that time it is NTA antibody and NTB antibody, both the antibody will be produced. So here you can see antigen, if antigen A, B both are present, there is no antibody. So there is no antibody, so it can be take blood from anyone, because there is no antibody is there, no coagulation will take place. So this is become universal receiver. And last one, that is the NTA antibody and NTB antibody, both the antibody is there, so it can give blood to the anyone, so it is become universal donor. So now we are going to discuss about the donor receiver compatibility, from which people can take the blood, from which they can't. So Here first we have to write the AB plus, AB minus, A plus, A minus, B plus, B minus, O plus, O minus. So these are the receiver, and this side it will all become donor. For AB plus, they can take blood from anyone. O minus, O plus, B minus, B plus, A minus, A plus, AB minus, AB plus. AB minus only taken from blood from negative one. O minus, B minus, A minus, AB minus. A plus only O minus, O plus, A minus, A plus. A minus taken from O minus and A minus. B plus, O minus, O plus, B minus, B plus. B minus, O minus and B minus. O plus, O plus, O minus. And O minus taken only from the O minus only. And it gives blood to anyone. So it is become the universal donor. And AB plus, it is take blood from anyone, it is become the universal acceptor. So here we have to remember the negative blood taken from the negative blood only. If you have AB minus, you can take blood from O minus, B minus, A minus, AB minus, A minus, O minus, A minus, B minus, O minus, B minus, O negative, taken blood from O negative only. So this is about the blood grouping and how to you have to differentiate the blood grouping. I hope you understand this topic. If you have any doubts, comments below. Thank you. See you in the next video.